also to shape the future of medicine. As a clinician myself with many years of experience, I stand there not just as a moderator, but also as a very keen and avid learner. Also because, I also started research quite late in my experience, in my clinical experiences, and I'm willing, obviously, to learn from these robust also panels we do have from all around the world. And I'm sure you're also very keen to learn how to start your research or even consolidate on your research experiences. When I also further had a conversation with Ada Academy, one of the objectives of this program is actually to bring also panels and people together, clinicians, healthcare professionals, also statisticians, to come together and collaborate and see how we can inspire people, to work together and start landmark research. And I do think that real progress really would happen when we all learn from each other. And I think another very critical importance of today is that we are actually in the fourth industrial revolution, where we do know that artificial intelligence, machine learning, and data science are redefining what is possible in healthcare. And I think through research, we can actually harness these tools to generate also powerful insights. And I'm glad to tell you that, one of the professors there, is actually a professor of machine learning and also statistics. So it is quite apt and quite very right on point, even for them to be available in these times in medicine. And so today I feel, as we learn from these distinguished speakers, we should think beyond just publishing alone. We should think about innovation. We should think about solutions to particular healthcare problems, be it, either stroke recovery, be it also public health, also communicable disease, or whatever field you might be, but to think about opportunity to solve problems. And also another opportunity to actually collaborate into medicine to solve medicine deepest problems. So I think also together we can build a research culture, hopefully, that combines also compassion, clinical wisdom, and cutting edge also technology. So welcome once again, everyone, also for joining us. So today we have three important, speakers, and also they'll be also doing some very important presentation, which I think it's very apt that it is actually the first in this series. So the first speaker will be Dr. Nicholas Aderinto, and before I call him, he will be talking about medical research made simple, how you can turn your simple questions, your simple idea into a study design. Then after that, Professor Paulo Rodrigues, all the way from Brazil, will be taking us into tips on academic writing and research, also publishing from his wealth of experiences. And then Professor Olawale will talk about statistics demystified, what every medical researcher should know. And I think this is very important. As a clinician, I think one of my weaknesses is usually the statistics in research. If you're reading all those randomized control trials, meta-analyses, it is the statistics that are really, just makes you scared. So Professor Aware is here to demystify the mystery of this thing. And hopefully in the subsequent webinars, they would even make it easy for us. And then around 4 o'clock, we would have some interactive sessions where we would have opportunity to ask questions from our distinguished facilitators and panelists, and then we will close. So I think it's going to be an exciting day. I can see a lot of people have already joined. We're close to 70s. And so we will start immediately. So I don't know if Dr. Aderinto can just share his slides.
Okay, sir.
Yeah, and also, so as is actually sharing a slide, I will just read about this very great person. And I would say it's a great pleasure to introduce our first speaker. His name is Dr. Nicholas Aderinto. He's a young, I would say, an handsome physician scientist, whose work actually, beautifully bridges clinical medicine and neuroscience. He's a Nigerian and UK licensed medical doctor, and he is actually doing his PhD at the University of Utah in the United States of America, where he is exploring how neural repair mechanism in post-stroke patients, using advanced neuromodulation also techniques. He's young, but he's mighty. He has authored more than 150 peer-reviewed also publications and co-authored 2 books, also chapters. And he serves as an academic editor of PLOS ONE, while he is also reviewed a lot of journals, including The Lancet. Just recently, he was ranked among the 500 top medical researchers in Africa. And he's also a part of a rare movement disorder steering committee of the International Parkinson's and Movement Disorder Society. Today, he'll be sharing the trick and the tips, how at this point he has more than 150 peer-reviewed also publications. So be sharing to us medical research made simple, how you can turn your simple questions, your simple idea into a study design. Over to you, Dr. Nicholas Aderinto.
Good morning. I'm sure it's evening over there, but it's morning here. Just 9 a.m. here. Good morning, everyone. I'm Nicholas, and today I'll be taking us through some simple steps to changing and converting and transforming our ideas to what we can call a study idea and hopefully publish them. I want to appreciate Dr. Bolaji. Dr. Bolaji is my mentor. He has been an inspiration for me, a support for me on my journey in the past few months that I met him. And I want to thank Profs for bringing this platform to share my little knowledge. I'm Nicholas, and I'm a clinician, scientist, and early career. Yes. Okay. Okay. Why does, before we go on, we must know why research matters. And that's what I tell people, that what do you want to get out of publishing? And I've found that quite a number of times people don't have an end goal in mind when they start research. And the thing about publishing and doing research is, yes, in medicine there are things that it can actually afford you. You want to apply for residency, you want to go to graduate school, you want to be known and things like that. But at the moment, I think that end goal in the mind of a lot of medical doctors and even non-medical doctors going into graduate school is eroding the real impact that research should be making. And I think one of the good things that happened to me at the very, very early stage, I'm still at the early stage of my career as a medical researcher, but at the infancy, was that I didn't know that what I was doing was something big big in terms of it will afford me probably opportunity to get into big residency program or prestigious residency program or prestigious postgraduate school, or people will know me on LinkedIn, they'll be calling, they'll be, all of those social media stuff. So I was just likely doing what I was doing in Ogumosho in Lautech as a 200 level medical student back in 2015. I wasn't on any social media. LinkedIn was not even, I think LinkedIn was just coming on, and sharing things there was not so much. So together with my colleagues there, we just wanted more knowledge, wanted to see how we can contribute, even though we don't have all the resources. So, and I think that really helped. I just, I just have it in mind to just bring this, especially for the younger colleagues that, or my colleagues that are following, because these other end goals, they are actually eroding what research should be doing. Research primarily is to advance medical knowledge. We want to improve patient care. Anything you are doing, you should be thinking patients, you should be thinking knowledge, you should be thinking, if I push this out, is it going to advance what is currently being used in practice? And also, I found it to be a good source of innovation and curiosity, and also critical thinking, which is one of the big things I'll be sharing today. Okay, so I'm just going to do a brief breakdown of study designs. Basically, in research, there are various ways you can go when you want to break down study designs. You can go quantitative and qualitative manner. Qualitative is not so well known in medical research, but actually in the last couple of years, people are also advocating for qualitative research, because we've seen that sometimes some of the quantitative research that we do not actually address patient concerns. So people have cheated and people have done a lot of qualitative work, exploring, doing interview-based interventions and things like that. But primarily for the quantitative study, you can break it down also to primary studies and secondary studies. And these are just some of the examples of premise studies: descriptive, observational, experimental. Under descriptive, we have case studies. Case studies basically just mean it's usually geared towards sharing a real knowledge that you see in the course of your practice. Maybe you saw a patient with a rare disease, or you manage a patient in a rare way, or a patient presents in a rare manner, and you were able to successfully detect. You can share to the literature, share to the medical community, and say, "Oh, this is what we saw in medicine." Never say never, and this could also be happening too. That's what we likely do in case studies. In observational study, for cohort study, it's usually prospective. I usually say you are just looking forward. Maybe we want to look at an association of, let's say, maybe smoking, or for instance, we can look at medical students, divide them into two at undergrad level or in their first year in medical school, and see people that receive mentorship and those that do not receive mentorship. And we can look at their academic performances, let's say at the end of their preclinical years, or at the end of their medical years. So we can be able to say that over the course of 6 years, we track these people, those that receive academic mentorship, those that did not, and probably we can say academic mentorship helps increase the performance of medical students throughout medical school or not. In case control is actually the opposite. You're actually tracking back. Let's say we have a group of medical students in 600 level now, and we just want to look at what are the things that impacted their academic performances in terms of in their final year. And we just want to look back, what are the factors they were exposed to, mentorship, group discussion, does it actually work? So that's what you do basically in case control. And in cross-sectional study, as is popularly known, we are just taking a snapshot of what is happening currently. So at the end of this webinar, we can share a questionnaire and say, let's look at the knowledge base of participants that joined this webinar. So, and the experimental studies is largely clinical trials and or clinical studies. We have preclinical studies looking at animal, and then you can phase it: phase 1, phase 2A, phase 2B, phase 3, phase 4. and looking at that. And in conducting your clinical trials, you can either be non-randomized, randomized. There are other modalities around this, but these are just the basic broad way that we can break down study design. And this is important because whatever idea you are thinking, you must be thinking, does it fall under a quantitative study? Okay, if it falls under a quantitative study, will I be able to do a primary study or a secondary study? If I'm doing a primary study, you are thinking in your mind, based on the resources I have, based on this idea, will I be able to track it in any of these? It really matters that as you are thinking of the idea in your mind, and I'm going to be sharing with where you can get your research ideas, but your idea must always matches whatever study design you are thinking. So if you are thinking of exploring the longitudinal uh, factors or something, you cannot use a cross-sectional study, for instance. So this is where an accurate and a good grasp of study design becomes important in matching whatever research question that you have in mind. And these are some of examples of secondary study. You can do secondary analysis of original data sets. So in countries, United States, we have the NHIA data, whereby people collect data across the country and they are available. They are public set data. I think in the United Kingdom too, there are governmental public set data that you can get public set data from and analyze. And also you can do reviews. You can do narrative review if you feel like, oh, the research question I have, people have actually worked a lot on it, but what is the current broad overview of what is happening? Let's critically examine the literature. You can do a critically appraised topic. You can do scoping review, rapid review, systematic review. All of these also have their nitty-gritties. In narrative review, for example, narrative review is quite flexible. It allows you to be able to infuse some of your opinion when looking at the literature broadly. Quite different from systematic review and meta-analysis, which are quite rigid. You have to follow the structured way, and we have the Prisma guideline that is the gold standard in doing systematic review and meta-analysis. And then you have the scoping review and rapid review. Okay, so the big question with generative research idea, and I've always found this quote by Zora to be important. He said, research is formalized curiosity. Anybody who is not willing to be a critical thinker, who is not willing to be curious, cannot do research. And that's why every scientist or everybody intending to be a scientist, to be a medical researcher, needs not to forget their curiosity. I know our medical training trains us to be rigid, to think in a linear way, to think A plus B must equal to AB. But you must always ask, why does this happen? What puzzles you in your daily work, in your daily clinical work? What is the mechanism of action? What if we do it another way? Okay, so for instance, I would just want to take some comment in the chat box. If you're a medical doctor, is there anything that ran through your mind this week at your clinical place of work that you think, oh, can I explore this idea? Are we doing things the way it should be it should be done? This equipment that I'm using, what is the mechanism of action? How does it work? I would just want to see comments or probably give mic to one or two people. During the last week, did anything come to your mind at your place of work? Did you have any curious idea? If yes, were you able to put them down and jot them down? Because that's where research ideas start. Most of the research ideas I've gotten has been in course of my clinical study. And one of the biggest questions I get from people is, how do you generate your research questions? So I don't know if there's anybody that can share something. It may not be a medical doctor, it can be a researcher, it can be anybody.
Yeah, I can see that somebody is already popping it in the chat, also the interesting things. The emergence of artificial intelligence and mental health. Somebody said, while labetalol seems to have varied effects on hypertension, works poorly sometimes and sometimes works too well. And somebody also said, is there any relationship also between, psychosis and something? Yeah.
Good. So, like,
So between AI and psychosis. Yeah. Looks interesting.
interesting stuff. Interesting stuff. And if I can bet you, if you write that down, you refine it, you are going to produce a good stuff. You can start with writing even a letter to the editor, a perspective article, and that's where it starts. Then you talk to people, you refine it, and that's how you get your idea. For instance, during 2020, we were largely before COVID-19. I think COVID-19 chased us out of school around February ending. But at some point, we use pulse oximeters a lot in the accident and emergency. And in 2020, I think I was still in 400 level. Yeah. And I was just going and I thought, how does this pulse oximeter works? Which is a question nobody has ever asked us in clinical medicine. It's just always, what is the oxygen saturation of this patient? What are the causes of low oxygen saturation? Medicine one, 10 causes of this, 10 causes of that. Nobody was asking us mechanistic questions. So we didn't even know, I didn't even know how pulse oximeter that I hold in my hand every day, how does it work? And when I find out the way it works, I found out that there's likelihood for racial disparity in the pulse oximetry result that we are getting. Because pulse oximeter basically works by light refraction. And measuring refraction in a black man and in a white man will actually give you the different results. Unfortunately, most of the pulse oximeters we use in Africa were pre-tested on white people, which means there's likelihood that when we say a patient pulse oxygen saturation is at 92, is actually at 88%. I went to the literature and actually saw that people have explored this idea, and I'm going to share the study now. I'm sharing this story to see that this is the way things work. I'm not sure, I don't know if my screen is still, if my screen is still, can you see my screen?
Yes, we can see your screen. We can see the racial bars in pulse oximetry.
And this was a study I found then. The study was first published in 2020, but they corrected it in 2021. I think some things were wrong there. And I saw the study and I said, oh, wow. And this study was quite a big stuff, but I noticed that nobody was even talking about it in Africa because this study generated a lot of issues in the United States. Generated a lot of issues because they saw that there was at least about 4% differences in the when the actual oxygen saturation level for Black people and the one for white people. And that means during COVID-19, that means oxygen was not being provided for more Black people because based on guideline, I think it was, you have to reach 92% or something. Meanwhile, actually, the oxygen saturation was actually 88%. And it was a big issue. And these are issues that nobody has even talked about, nobody has explored. This is a big research idea for me. If I have the capacity, the funding, is something I plan to look at in the future. All the patients that we are measuring their oxygen saturation in Africa using white dominated equipment, we might actually be shortchanging our patient. I wrote a letter to the editor, perspective. Nobody was willing to publish. Obviously, all of us, we know the politics that can happen in medicine. I'm sure nobody was ready to follow me that way. So I just wrote a little piece for one of the Nigerian news outlets, the cable, and which I just wrote on the pulse oximeter bars, making a case for the black color. So let's just go back here. Yes. So that's one way. When you hold an equipment in the hospital, in your laboratory, you should be able to say, how does it work? From there, you will see that a lot of things. So mechanistic questioning really also does a lot of things. So another way that I found to be very useful for me is okay, I also think of what is happening around me. And I'm going to share some of the studies that we've published that models some of these ways of generating. I keep questioning myself, what is happening around me when I go to work? How are patients behaving to me? How am I reacting to patients? Am I overworked? Are things working? Then, big one, you must chat with your friends. Your friend is in Nigeria, your friend is in Kenya. You must always ask, what is happening over there? How do you manage your patient? How do you do things there? Are you doing things differently and getting the same result as we are getting? Are you getting more result than we are getting? Speak with senior colleagues. A lot of times, Dr. Bolaji and I, we talk extensively and he shares great ideas. Some of the ideas we have already turned into papers. I think recently, we just finished a systematic review and meta-analysis looking at use of virtual reality in acquired brain injury. We've worked on looking at, oh, okay, people don't look at cancer as a major risk factor for stroke. Can we look at what people have done? And you will see that these are some of the things we miss. Nobody really cares about looking at cancer as a risk factor. And there was a time also I just sat down and thought, oh, can malaria be a causative risk factor in stroke also? And we found that people have documented case report that the cause of stroke in patients were actually malaria, which we put together and we published. We published it in the malaria journal, looking at malaria incidences, malaria diagnosis in stroke, and things like that. So you must always talk with senior colleagues and you must talk with your junior colleagues. The likelihood is that your junior colleagues have not they are more curious than you because they are more open-minded. They've not been exposed to so much knowledge. And then you must cross-breed knowledge. You must talk to people in other fields. Don't just stay if you're a doctor, don't speak to doctors alone. If you're a nurse, don't speak to nurse alone. If you're a laboratory scientist, don't speak to laboratory scientist alone. If you're a geneticist, don't speak to, because medicine is basically interwoven. In the last few weeks that I've been here, I've worked with people from different units. I've worked with people from population health system. I've worked with biomedical engineers. I've worked with electrical engineers. I've worked with medical neurologists, neuroscientists, and you will see that people have perspective where they bring things in. When an electrical engineer is thinking, the brain is behaving like an electric current. That's what they think. I don't think the brain behaves like an electric current more. I'm more concerned about the clinical outcomes, the clinical, how does it work? But they are thinking, oh, when a neuron depolarizes, it is at so millivolt. What can we do to change that? The ideas explode. And a big one is adapt global studies locally. Two of my friends and I, we always say, you can shine from Africa. There are a lot of things that have been done in Western countries that we have not even explored locally. You can always adapt some of these global studies locally. And then there's just some moment out of the blues where the idea just come. You don't even know how, and you must always read. You must always read the literature in your feed. At least I usually recommend, if you're starting, read one literature in a week. If you want to really grow fast, read one in a day. So what is happening around you? This was just a study that I explored when I was doing my internship in Lautech. I saw that during my internship, we had like 3 cases of workplace violence against medical interns. And I checked the literature in Nigeria. I saw that nobody has explored this even in Southwest Nigeria. And I said, oh, this is something we can explore. And we conducted this study across 10 teaching hospitals in the southwest of Nigeria. So these are, I think, I saw a problem. I saw, okay, today we had a workplace violence against a medical intern. A patient is behaving somehow. I think within 3 months, we had another one. Within 6 months, we had another. I just felt, oh, this could be something that we can explore. So that's in the concept of, you must always check what is happening around you. And then conversation with senior colleagues, with junior colleagues, with friends. This was what brought this article. Dr. Oliver is a neurologist here. She's an headache expert in the United States. And we're just chatting one day where she brought the concept of using chart calendar and questionnaires to reduce the number of hours patients spend in consultation, because she was complaining about the number of duration she used with patients when they are coming in. And we're just thinking, are there things that could reduce this? And we saw that people actually bring in the idea of using chart, calendar, questionnaires, even as patients are waiting to see the doctor. If they can fill all of this, it reduces the time in conversation with medical doctors, reduces the patient load on doctors, and also improve the consultation with for the patient themselves. And then adapting global studies locally. This study is a two-part study that one of my friends in the United Kingdom did. I think he did across all it's a big study. They call it the AIMS UK study. It was a big study across the United Kingdom done by I've forgotten. Yes. And I just had to collect the questionnaire from him and see, can we do this in Nigeria also? And we adapted the questionnaire to the Nigerian context, pre-tested it, checked for the internal validity of the questionnaire in Nigeria. And this was what brought about this study. And then out of the blues, I think one day I was just thinking, oh, okay, there is a lot of talk about looking at in vitro fertilization now. People are more open to it than it was before. But people have, what is the literature saying on the long-term impact on neurocognitive development? People that are children that were born through in vitro fertilization, do they compare better than people that were naturally through the natural birth? And I just have to, I didn't know what I was doing that it just came to my mind and boom. And this was how this came about. So these are some of when you have your idea, you can also run through this common question framework. You can use PICO. I always tell people, when you are converting your idea to a research question, you must always ensure that what is your patient population or patient problem. You must always have this. You will see, it's just because of time, if I ran through you back to some of the studies that are published, you will see that there's always something about patient problem, patient population. Then you must always have what is the intervention, or what are you exploring. Then comparison is not always is an optional function there. And then there must always be an outcome when you are bringing your research and you are trying to frame it as a research, your idea as a research question. So this is a framework you can use. Once you have your idea, just sit down and say, okay, what is the patient problem in this idea? Or what is the population in this idea? Then the next thing is, what is the intervention I'm considering, either mechanistically or in terms of you want to actually apply the intervention yourself, or how does it work? Why does it work? Then comparison, if you find that in your idea there's a comparison, write it down. It may not be. Then what is the outcome? What exactly are you interested in looking at? Then PO is basically more used for qualitative research, population exposure outcome. And when you are using the mixed method research, people are actually using mixed method research too nowadays. You can consider SPIDER. So just in a few, I know my time has gone, but I just want people to just give me examples along this line. So the research question for narrative review and systematic review is usually, what is known? What is known about this already in this field? And I would just like to see comments, just research ideas that you've thought of in the last couple of weeks that actually fit into this gap. Also, how common is what we think about when we are thinking about cross-sectional study. When you are thinking about case control cohort study, you are thinking, what causes this? And when you are thinking of experimental studies or randomized control trial, you are thinking, does it work? So I would just appreciate if you can put in the chat box, or you can speak some example of ideas that you've had over the last couple of days, over the last couple of weeks, that you think actually fits each of these, whether what is known, how common, what causes it, does it work?
I think about the narrative or systematic review, talking about the surgical smoke, when you go into the theater, when during dissection, there is this there is this device that is being used that produces smoke when when the surgeons are operating. So the question
Oh yeah,
is this
I think
smoke is
diatomy or something. Yeah.
yeah, they tell me, yeah. So is this smoke actually harmful to the health, or does it cause a long-term problem? And this is a curious question, So I don't know
Yeah.
if it
So
falls with the narrative or systematic. So,
yes, I think you can. It depends on the convenience that you want to go with. If you want to go with a great level of convenience, you just to choose narrative review. If you are looking for something that is high up there in the level of evidence, systematic review and meta-analysis actually is a level one evidence in medicine. So we can actually explore through that route. Another thing is we can look at those patients over time also and see patients that had use of this, did they actually, the surgical wound, what's the rate of recovery? And this is a big systematic review question already now. Patients that had surgery that they had use of that, I mean, the ones that not have, how does it compare in terms of the healing of their surgical site wound? This is a topic on its own already, just from this idea that can be explored at any level, Let me take one more and let me move on,
yeah.
because of time. Okay, I think. So basically, in conclusion, I would say every research starts with a question, and every question starts with an idea. Don't forget, I said, always check what is happening around you. Why does it work? How does it work? Is it even working? Don't forget to chat with your friends, your colleagues, your junior colleagues across hospitals, across continents, and then always choose a design based on your question, like I've shown in the last table. When you have a question, sit down and see which study design fits based on the idea, my capacity, the resources available to me, and then always know that simplicity and clarity will always bring credibility. It doesn't have to be ambiguous. Collaborate. One of my key success over the years is I've collaborated with a lot of people across continent. Collaborate with your senior colleagues, your junior colleagues, your colleagues, document and publish. And I will say thank you, yeah. And I think I'll be coming on later if there's any question for me. Thank you. You can reach me through my email. Thank you very much.
Wonderful, wonderful. Thank you so much, yeah, Dr. Aderinto, for that very, brilliant talk, on how medical research can be easy. And thank you so much for sharing some of your tricks, and the tips. As you said, in the year 2020, you're a 400 level medical student, right?
Yeah. Yes.
Yes, and and it shows the capacity, and you have more than 150 plus even publications, and so yeah, I just want to appreciate you for that very good.
Thank you, sir.
Good discussion. And just also before we move to Professor Rodrigues, obviously there will be questions. We have a question and answer session later on, where
Okay,
we'll invite you back. But I just want to summarize some of the things you said. You said research is a formalized curiosity, by Zora Neale Hurston. And I think this is very important. It's all about asking questions. What's happening around me? Why is this thing happening? That is a premise of research. And when you now, ask more questions, questions will lead to questions, and then you can now, start thinking about how to answer those questions. And answering those questions is how, if you want to, know what is already known, you can do narrative review, systematic review. If you really want to know the reason underlying things, you can think about, a trial. So I think it's interesting. And also something you also said, which I think is very important, is that also collaboration and conversation is a key. And which is one of the things, I spoke with the president of ADA Global Network. The key thing about the ADA is actually to collaborate with people. We've got fantastic clinicians, researchers, also statisticians. How can we work together and tackle a problem? And And I really liked also what you said about cross-breed knowledge, which is actually combining insights. Very important, very important. And that is the principle of collaboration. How can we collaborate with everybody, and how can we solve a problem? And I think, the eureka moment, always. Okay, thank you so much. I think that was a very fantastic, and we'll be happy to have you later on for the panel sessions.
Yes,
so we are moving on. I'm sure you've been inspired, by also the first talk, and without also further ado, we'll be moving on to the next also topic, which is going to be by Professor Paulo Rodrigues, on the tips on academic writing and research, also publishing. And I would encourage Professor Rodrigues to start sharing his slides now. And while I just read a bit, about his bio now. So Professor Rodrigues is a professor of statistics and data science at the Federal University of Bahia and the director of the Statistical Learning Laboratory, SALI. He completed his PhD in statistics at Nova University of Lisbon in Portugal, and his habilitation in mathematics with a specialization in statistics and stochastic processes at the Lisbon University. He has had different research in time series, in forecasting, in statistical learning, in artificial intelligence and data science, and he has more than 120 scientific also papers with a collaboration with more than 180 co-authors from 86 universities in 31 countries. Among other activities, Professor Rodrigues is currently the president of the International Association of Statistical Computing and is a member of the Representative Council of the International Biometric Society. And is a council member, one of the 10 also council member of the International Statistical Institute, which is a top statistical organization in the world. So it's a privilege to introduce and to invite Professor Rodrigues to speak on this topic, on the guide to academic writing and research publishing. Over to you, Professor Rodrigues.
Thank you very much. Can you hear me, Paul?
Yes, we can.
Thank you very much for the very kind introduction. I also want to thank Professor Olawale for the kind invitation. So I'm going to share a little bit about some thoughts about academic writing and research publishing. So let me just, Paul already said everything about me. So just briefly, I spend my time when I'm not in the classroom. I supervise students. I do research, of course. I contribute to the academic community, national and international, for Statistical Association generally. And I also spend some time related with journals, research journals, scientific journals, and publishing. So I'm currently co-editor for computational statistics that if you are a statistician, you probably know about it. Also, I'm involved with the Brazilian Journal of Biometrics, Biometrical Letters, Statistics Optimization, and Information Computing. So in these journals, I'm a co-editor. And then I'm also associate editor for several others, among them the Brazilian Journal of Probability and Statistics, the Stats, Measurement, the Journal of Data Science, Statistics and Visualization, and then also more recently the Journal of Applied Statistics, Environmental Science and Data Science section. Okay, so I spend my time in these kind of things. I do my research mostly in time series forecasting and statistical learning, but I'm also starting in some strong directions on artificial intelligence and some other things. So writing, we have to write, right? Because we are doing science, so we have to share it with someone. So it is, what I have here is that science is not finished until it is communicated. If we do not communicate what we do not show what we do, so we don't get the results out to the world. And to write, it transforms the data that we have into knowledge. So it's not just about publication, but it's also about showing things in a clear manner, in a way that can be reproducible. This is very important. We need to do things that others can reproduce, because otherwise it might look like we are making things up. And of course, we are always looking also for a legacy. So in terms of writing, when we start to write a paper, there are some struggles. One of them is the blank page paralysis. That, well, we have an empty page and we have to put there something. So we'll never get the perfect start. So it's better to start with a start that is not perfect. Also a struggle is, what is the message? So when you write a paper or a thesis or a report, what we are telling is a story. We are telling a story. We have to tell these people that are reading, okay, this is what happens in the world. This is what people have been doing. And we are doing something that people did not do before. So we have to have a clear message to say, okay, these people did this, these people did that, and we are doing something that those people did not think about. So we need a clear message so that the paper is read and eventually published. Also, a big struggle is when you write as a second language. So I'm not native speaker for English. I speak Portuguese as my mother tongue. So that is also a struggle, because people that don't have English as a native language, they are in a bit of a disadvantage. And of course, I don't think we should look for perfection. We should go for the best possible outcome, because nothing in the world is perfect. And if we are just revising the same text, the submission, that is the final aim of research, will be delayed, that it can be from years or months. Something that I think is important is that the writing should start as soon as possible, because sometimes people start to write only when they have all the results, and that is a big struggle. Because I had, as an example, I had a master's student that he already defended his thesis, that he had the results for a very long time, and then he struggled a lot for writing the final text. So I think it will be important that we should write in parallel with the analysis, because if we already have a clear direction and a clear idea of what we are doing, we can start to write right away. So that's, I think, a big thing that we should do. And of course, we have to go from an idea to a text, which can be a report or a thesis or a paper. So we have to define what is new in our work, especially if we are aiming for a scientific paper, because journals only publish things that are innovative. So we have to make clear what is new and to state it clearly so that people can read and can understand what we are bringing extra to the field.